Hi, this is Dr. Rob Rozbruch, and I wanted to share with you some information about ankle distraction arthroplasty. This is an excerpt from a lecture that I gave in Japan as a visiting professor. We published our experience on ankle distraction arthroplasty in our first series of cases back in 2009, where we showed that patients had a significant improvement in functional scores, and that this was a great procedure to preserve the joint and avoid ankle fusion or ankle replacement, particularly in younger patients. Turns out it's a procedure that does not burn any bridges, and we had excellent short-term survival at that point. As an update to that, now in 2016, we've done over 300 cases, and we've recently looked at our survival, and it turns out that at 9 years average, we have 85% survivorship. That is, patients have not gone on to fusion or replacement. But of course, the procedure does not burn bridges for those procedures should they become necessary. So this is an example of a woman who has advanced post-traumatic arthritis in the ankle with joint space narrowing, bone spurs in the front of the ankle. And after cleaning out the ankle, removing spurs, debriding arthritis, and applying a distraction frame for a period of 3 months, this is the kind of result that we have at 1.3 years later. You can see increased joint space, and this corresponds to a substantial improvement in her pain. You'll also notice that the spurs have not regrown, and that the sclerosis, or the hard bone just at the joint level, seems to have disappeared. Now, when we look at that case with an MRI beforehand, you can see that there's very little joint space. There's really no cartilage present. There are cysts present in the subchondral bone, which is the bone just adjacent to the joint. And when we look at these patients afterwards, 1.3 years later in this case, you can see that there is really a reversal of arthritis. You can see there is a nice layer of cartilage-like substance cushioning the joint, and there is resorption of the subchondral cysts. Essentially, we're seeing reversal of arthritis. So with ankle distraction, we mechanically unload the joint, and this leads to a reparative process of cartilage. There are several components to the procedure we do, which includes biological stimulation. We open the joint, clean out the arthritis, remove spurs and any debris in the joint. Any areas that have full thickness loss of cartilage, we treat with microfracture by making little small drill holes that allows bone marrow to come to the surface. In addition, we also add bone marrow aspirate concentrate, which contains stem cells, and this helps with the cartilage reparative process. Many patients have equinus contractures, which means they cannot get their heel down to the floor completely, and so we do some soft tissue release procedure that assists with that. And then mechanical component of this is firstly to remove the anterior osteophytes, or the spurs in the front that are blocking dorsiflexion. But then we also place a hinged frame that maintains range of motion during treatment and also allows gradual correction of equinus. If you look at this example of a 40-year-old woman, she has difficulty getting her heel down to the floor. She has arthritis with decreased joint space, particularly in the front of the joint. We apply an ankle distraction frame for a period of 12 weeks. You can see the joint space increased on the x-ray. The frame allows mobility, as is illustrated here, and we encourage weight bearing during treatment. And you can see as a follow-up, approximately 1 year later, there's a substantial increase in joint space noted on both the AP and lateral x-rays. Now, the mesenchymal stem cells are obtained from the patient themselves, and it's called bone marrow aspirate concentrate, or BMAC. And that's a great source of stem cells that we add to the ankle joint in the distracted state. This is a picture showing the distracted ankle at the end of the procedure with a injection of the stem cells into the joint. This is what a typical ankle distraction frame looks like. You can see it's hinged. allows mobility, and allows distraction. The frame is hinged and maintains motion, but at the same time maintains distraction, and that's a key component of this procedure. Another example of a 40-year-old active man who played D1 college football presented with pain, joint space narrowing, anterior osteophytes that were limiting dorsiflexion. We did the same procedure just outlined, distracted the joint, removed anterior osteophytes, performed microfracture on areas with full thickness loss of cartilage, and injected BMAC or cells. This is what it looks like on a follow-up visit, standing, maintaining the joint space. This is a reminder of what the before picture was like, and this is at a year later. And you can see there is a joint space that was not present beforehand, with padding and cartilage inside the joint. This is the same patient functionally, demonstrating his active and passive motion of his ankle. And his function is dramatically improved with this procedure over 1 year later. And he's very, very happy with the outcome. Another example of a 35-year-old patient with a before illustrated here. You can see the joint space narrowing. You can see the subluxation of the joint. And this is at 1 year showing a well-reduced joint with increased joint space. I want to thank you for your attention, and I'm glad to have been able to share this update on ankle distraction arthroplasty with you. In summary, this is a very powerful joint preservation procedure to protect the ankle joint, regenerate cartilage, and buy a substantial amount of time and avoid the need for ankle fusion or ankle replacement. However, if that becomes necessary in the future, this procedure does not burn bridges for those procedures. Thank you.